Dr. Xu Li, Paediatrician-in-Chief, Director of the Maternal Infant Research Center at Mount Sinai Hospital, and an associate member of the Lunenfeld-Tannenbaum Research Institute, has not merely questioned an important aspect of the science used in court, but discredited it to the point where it now has no foundation whatsoever. This is particularly significant because Dr. Li was the co-author of the sole paper used to diagnose air embolism in court, the central accusation made by the prosecution. Primary prosecution witness Dr. Dowie Evans has claimed that he used 18 studies in deciding on his hypothesis, but the most fleeting examination indicates that none of them were referenced in court diagnostically, nor in the Court of Appeal verdict. Only one of the other papers even references venous air embolism, and when other studies were cited, it was for the most ridiculously superficial and trivial reasons, such as one paper that referenced screaming in infants. Furthermore, all of these papers addressed the accidental introduction of air, and Dr. Evans has provided no material explanation, let alone clinical evidence, for why this air had to be introduced deliberately rather than accidentally. The insulin testing used in court has been demonstrated to be completely unreliable. Key forensic testing was never conducted, and the evidence presented in court doesn't meet basic and established guidelines of biochemistry. It should be emphasised that there are numerous other problems with the insulin cases and evidence used in court. A panel comprised of numerous world-class experts has trashed all of the scientific evidence presented in court. Numerous members of this panel are not only credentialed and highly regarded experts in neonatology and paediatrics, but they are also prolific authors of academic papers, with thousands between them, as well as being heads and in some cases founders of authoritative neonatology organisations, institutions and bodies all over the world. It is particularly interesting to compare their evidence with what was presented in court, as the forensic and surgical nature of their work becomes very apparent compared with the tangled web of what Dr. Evans presented in court. This is hardly surprising. Dr. Evans hasn't worked in a hospital for nearly 20 years at this point, has never qualified as a neonatologist, has never authored any academic papers, and is, essentially, absolutely nowhere near the standard of the panel. Over 50 experts across multidisciplines, all working voluntarily, are now available to Barrister Mark MacDonald in defence of Lucy Letby. This massively outranks anything that was part of the court proceedings, and it should also be noted that most of the expert witnesses in court provided either virtually nothing or literally nothing at all to support the prosecution case. There were numerous known mistakes from experts during court proceedings. These included bizarre comments made regarding the insulin cases and exogenous insulin, which are simply demonstrably incorrect, major mistakes made with regard to antiphospholipid syndrome, numerous examples of so-called experts missing critical incidents and then conceding this in court, one such example being vomiting events in the case of child G, assertions made in relation to child O which are also demonstrably incorrect, and of course the entire diagnostic foundation of the most important pillar of the prosecution case is fundamentally wrong. The primary prosecution witness has changed several of his diagnoses since the court case ended, not to mention during the court case itself. This is undeniably true, as he told mainstream media publications that he had done this, but he still later denied it anyway. There were all manner of bacteria circulating on the unit that were never acknowledged in court. These include Pseudomonas aeruginosa and Stenotrophomonas multifilia. Both of these bacteria are potentially lethal for premature, low birth weight, vulnerable neonates. The World Health Organization recently placed Pseudomonas on its list of the drug-resistant bacteria most threatening to human health. The condition of babies on the unit was completely misrepresented in court. Healthcare professionals almost universally agree that the jury was misled with regard to the condition of the infants in the court case. There was irrefutable evidence of infection in virtually all infants involved in the case, and to discount this, as Dr. Evans did in his so-called diagnoses, is simply untenable. Considering that there were 11 other deaths on the unit during the period of Letby's alleged crimes, when one assesses these deaths, the clinical picture of those included and not included in the court case is virtually interchangeable. Yet the jury heard nothing of this. They didn't even hear about the other deaths whatsoever. Countless medical errors were made on the unit. These include the incorrect insertion of a needle in the case of child O, doctors accidentally allowing crucial monitors to be turned off in the case of child G, countless errors related to monitoring the administering of antibiotics and basic hydration, medical mismanagement of the tension pneumothorax in one instance, various mistakes with intubation, continual failures to insert catheters in more than one instance, basic failures with the insertion of an endotracheal tube, major failures with resuscitation and ventilation, failures with the activation of alarms on the unit, failures to recognise signs of bacterial infection, failure to recognise and treat necrotizing enterocolitis, failures to recognise and respond to bowel obstruction, failures to arrange postmortems for some infants, delays in recognising respiratory distress, inadequate medical mismanagement of hypoglycemia, inadequate numbers of appropriately trained personnel, lack of training for assigned nursing roles, inadequate staffing, work overload, poor plumbing and drainage resulting in need for intensive cleaning, poor environmental temperature control in facility, difficulty in finding a doctor when need arose, congestion at medication cabinet and preparation trolley, lack of appropriate facilities for sterile preparation. Some high-risk infants who should have been born and cared for at high-level institutions were born and cared for in Council Chester Hospital because of a shortage of beds at high-level facilities where they should have been admitted. There were delays in transfer of sick infants to high-level facilities when the need arose. Medical histories were incomplete, failure to consider the obstetric history, disregard for surveillance warnings about infectious bacterial colonization, misdiagnosis of diseases, caring for patients that were beyond their designated level of care, unsafe delays in diagnosis and treatment of acutely ill patients, poor supervision of junior doctors in procedures like intubation, poor skills in basic medical procedures like insertion of chest tubes, poor management of common neonatal conditions such as hypoglycemia, lack of knowledge about commonly used equipment in the neonatal unit such as neopuff and capnograph, lack of teamwork and trust between healthcare professionals. There were major failures with testing on the unit. This includes, but is not limited to, failures to conduct follow-up testing in the insulin cases, no testing for conditions noted by the expert panels such as for enterovirus, failure to recognise dangerous bacteria circulating on the unit such as Pseudomonas and Stenotrophomonas multifilia, no genetic testing at all. Anecdotal evidence used in court has long since been revealed to be worthless. The supposedly suspicious diary entries have been revealed by nurses to be known nursing acronyms. There was never any meaningful content cited from Lucy's diary anyway. Text messages used in court are benign and uninteresting, revealing nothing of any substance whatsoever. Even Cheshire Police admitted this. The prosecution attempted to suggest that Lucy was somehow seeking attention from a doctor because she was having an affair with him, but were unable to present any evidence in support of this whatsoever. There was no evidence even of mild flirtation, and messages displayed in court even contradicted this basic premise. Much was made of handover sheets being found in Lucy's house during the court case, with the explicit suggestion made that these were kept as trophies. In fact, it is known that Lucy had kept one handover sheet only in a keepsake box, and it was completely unrelated to the case, being the handover sheet from her very first shift. Other sheets were found in bin bags in her garage, having been obviously discarded. A so-called confession note was clearly not a confession note, and was instead a counselling exercise written on the instruction of Catherine de Bager, an occupational health representative at the Council of Chester, who later submitted a favourable account of Lucy Letby to the Thirlwell inquiry. The statistical case used in court, which is fundamental to the prosecution, has now completely collapsed. Even leaving aside the science, there is literally no way of showing that Letby was present for these supposed crimes. Lucy's so-called constant presence was referenced throughout the court case. Without it, the prosecution case is literally without foundation, as there is no concrete evidence against Lucy Letby, and thus without this coincidence theory that is at the heart of the prosecution, literally anyone in the unit could have committed these alleged crimes that obviously never happened anyway. It is now literally evidentially impossible to say that Lucy Letby is guilty. Every nurse who worked alongside Lucy at the Council of Chester has indicated that they had no concerns about her. Several of the nurses indicated their belief in her innocence. A few of these accounts are as follows. There are many others not included in statements to the Thirlwell inquiry. Joanne Williams. I did not personally have any concerns. Letby attended a number of collapses and deaths. She also worked full-time and worked a number of extra shifts to cover staff shortness or sickness. Caroline Oakley. I thought that Lucy was hard-working and efficient, and I did not have any concerns or suspicion about her or her conduct. Minna Maria Lapalainen. I was a friend of Lucy Letby. I attended some social activities with her. I had no concerns or suspicions about her nursing conduct on the neonatal unit, nor was I aware of any other nursing or medical staff members' concerns. The anonymised nurse Y. I do not believe there has been physical evidence to prove criminality by Letby. I was not aware there were any concerns regarding Letby's practice until we were informed as a team about the external review. I do not feel the infants are at risk from criminal actions. I do not recall having any concerns about Letby during my time as her allocated mentor. I did not need to seek any guidance from the practice development practitioner or practice education facilities during her neonatal placement, nor did I have any suspicions about her in my role as mentor. Caroline Bennion, I recall Lucy Letby being a professional and competent nurse. I had no concerns regarding her practice. Belinda Williamson, I never had any concerns or suspicions about the conduct of Lucy while I worked on the neonatal unit. I found she was very conscientious, and if she was concerned about an infant, she would come and discuss the matter with me if I was in charge of the shift. Janet Cox, I had no concerns or suspicions about Lucy's conduct. She was an exemplary nurse who is completely innocent of all the alleged crimes. Cheshire Police somehow managed to reverse the swipe card data used in the court case for 9 infants involved in the case. Furthermore, the prosecution failed to account for another entrance and exit from the unit, which did not have a swipe door, literally rendering this entire portion of the court case completely worthless. The prosecution made several mistakes in court, and on more than one occasion, Lucy Letby had to actually correct incorrect statements made by prosecuting barrister Nick Johnson, who even acknowledged these mistakes in court. The prosecution literally pulled key evidence used in the case out of the ether. 2 examples of this relate to swipe card data and Datix information used in court. When Datix information exonerated Lucy Letby, the prosecution, without any evidence whatsoever, suggested that it had been fabricated. When it could be made to support the prosecution case, they cited it as being reliable. In the case of swipe card data, there was a surreal moment in court when Lucy pointed out that swipe card records placed her in a certain place at a certain time. Nick Johnson, prosecuting, stated that Lucy could have sneaked in behind someone else without swiping, which of course literally applies to every single instance of swipe card data used in the court case, much of which the prosecution attempted to cite as being accurate and unchallengeable. We now know from emails that have recently been revealed that Dr. Ravi Jairam gave a completely misleading account in the case of Child K, having previously indicated that it was important for the consultants to pique the interest of the police. At some point, the prosecution alleged that Lucy Letby had called a doctor to attend an infant when a child had collapsed because she was supposedly infatuated with the doctor. What they were asserting there was that Lucy Letby should not have responded to a medical emergency. Of course, if she indeed hadn't responded, that would have been held against her instead. The jury heard virtually nothing other than the quackery of Dr. Dowie Evans. They didn't hear about the pathology reports. They didn't hear about the RCPCH review of cases. They didn't hear about the catalogue of issues at the hospital. They didn't hear anything about Catherine de Beger and the confession note. They didn't hear from any medical defence witnesses. They didn't hear about bacteria present on the unit. In fact, they didn't hear about the vast majority of things mentioned in this video. The judge of a previous case that primary prosecution witness Dr. Dowie Evans had been involved with wrote to the Letby trial judge, James Goss, describing his evidence as worthless among other criticisms. Instead of being thrown out of this hugely important court case, which is what should have happened, Dr. Evans was allowed to continue to give evidence, and the overwhelming majority of medical evidence in court, 95% would be a conservative estimate, emanated from Dr. Evans, whose evidence had previously been described as worthless. In recent days, there has been some discussion of the cancellation of a television drama of the events at the Countess of Chester. The producer involved with this drama, Jed Mercurio, tried to pour scorn on this. The assertions of Mercurio were already crumbling under their own weight in discussion with Dr. Philip Hammond, but then it emerged that both Mercurio's name and production company were discussed during the court case. Now, it's obviously highly unlikely that they were discussing a dramatisation of these events during the court case, but it's probable that Dr. Jairam had been looking for his public image to be massaged so that he could advance his burgeoning TV career and become the next Raj Paso. Well, I'm sorry to disappoint you, but I don't think that's going to be happening now, Rav. Do you? Dozens of mainstream publications and hundreds of credentialed people have now spoken out on the Letby case, indicating the likelihood that it is a miscarriage of justice. The official editorial policy at the Daily Telegraph is that events at the Countess of Chester should be re-examined, this time ideally by actual scientists, not Dowie Evans and Paul Hughes. Josh Halliday, who reported on the entire court case for The Guardian, has changed his mind from likely guilty to likely innocent on the basis of evidence that has been uncovered since the trial concluded. Even top legal professionals have come forward to assert that this is a highly unsafe conviction that should definitely be re-examined. This has included Lord Ken MacDonald and Supreme Court Judge Lord Jonathan Sumption. Aside from that, the conviction of Lucy Letby is based on entirely sound evidence, and there is no reason to believe that anyone involved in the prosecution has made any mistakes. It's not as if there have been several high-profile miscarriages of justice, both recently and historically.